Hey guys, you ever thought about maybe that we should come up with some solutions for dry mouth? Or maybe I'm trying to get better as a restorative dentist, and there's a lot of challenges out there with saliva and dry mouth. What are some possible solutions? Well, if you've ever asked yourself that question, I've got two amazing clinicians on today that are going to show you some really cool innovations to the future of restorative dentistry, and you do not want to miss this. So stick around, grab a pen, and hit the share button. You're going to love this. Hey guys, welcome back to the Best Practices Show. My name is Kirk Behrendt, and I'm your host today, and you are going to absolutely love this. I've got two amazing clinicians, human beings on here today, and they're going to be talking about a very cool innovation that is going to be an important part of your future if you're a restorative dentist and you really care about your patients and your dentistry. So you don't want to miss this. Now, a couple things. We just love doing this. And so if you're new to the Best Practices Show podcast, most of you are already listening to this. It's amazing. Like, we create all these videos. You guys never watch them. You always listen to the audios, which I'm totally cool with. So if you're a young dentist, and we had over 38,000 of you join us in the COVID conference. And so if you're finding your way to the podcast for the first time, let's say you're listening on your phone and you're listening to Spotify or wherever you consume podcasts, do me a favor. See that little button right down there? It says subscribe. Just hit the subscribe button because I want you to show up with us, because every single week you're going to see I'm going to bring a brand new expert with some great thought processes, some great innovation, and some great learning so you can create a better practice and a better life. And I don't want you to miss out. And it's crazy how many cool people we've got lined up here in the future. So make sure you hit the subscribe button. Also, if you haven't joined our private Facebook group, let me put that graphic up for you. Make sure you join us over there. It's called The Best Practices, powered by ACT Dental. And there's over 13,000 of you in there. And I honestly don't even know how it works, but we had a lot of people join during the COVID conference, and it's pretty cool because if you have a question, you're going to see there's a lot of people that are just committed to helping other people on there. So make sure you join us over there. And then lastly, if you're looking for ways to just improve your practice, make sure you join us over at actdental.com. We've got the masterclass series over there where we have a brand new clinician every single Friday do a masterclass. You're going to see John Cranham's classes over there and a lot of other cool resources. And we're a coaching company, so we help dentists all the time. Even if you have a question, I love talking to the associates, even young dentists, like, can I practice this way? Your future is crazy important. And the coolest thing about dentistry is you can practice however you want to practice. There's no rules. My hope for you is you get out of your car, you walk towards your practice, and you say, I love this. We get one shot at this thing called life. And if you do it right, it's kind of all you need. So check it out. So I want to introduce my guests. And so I've got two amazing guests on today. And Tom, I've just gotten to know you today. And you're a friend of John's for a long time. And so maybe we could just dig up some dirt on him for a little bit. John, you've been a dear friend of mine for a long time. You've been on many of the things that I've done. You've been a great mentor of mine. And like we were talking before we went live, I stalked you years ago in Traverse City and told you we were going to be friends, and we have been. And you've been a great teacher of mine and a great leader of this community and a great leader at the Dawson Academy. And I think most of the people know you on here. But if you would do us a favor, just say a few things about what you're doing now, because I think it's pretty cool. And then introduce your good friend, Tom, because he's up to some pretty cool stuff too.
Yeah, so just having a great time at this point in my life. My daughter joined the practice back in July. She finished at the University of Louisville, so getting to practice side by side with her. My son's been with me about 4 or 5 years doing laboratory work. So getting to work with two of my 3 kids is great. Definitely still involved with the Dawson Academy. I did step down as clinical director, sort of right at the end of COVID, right before Caitlin joined me. Still involved doing the lecture classes and supporting Dr. Leonard Hess, who is the new clinical director. But what's really fun right now is I'm working with 34 great docs in a private coaching program that I'm doing now called Cranham Clinical Coaching, and it's the transition to digital. And so pretty much helping really excellent restorative dentists that have familiarity with working with a traditional analog articulator and wax ups and all that, but teaching them how to do it within 3 shapes, not the scanning software, but actually the lab software. So teaching docs to be able to put the old articulators out to pasture and to be able to do everything in a virtual environment and helping them be more efficient and productive and all that. So a lot of this is online training and then one-on-one coaching calls, Zoom calls a month where we kind of work through the buttonology. So that's what I'm doing, teaching a little bit less on the road, but spending more time in my practice and then connecting with docs on a more intimate level through technology, which has been fantastic.
Awesome. Awesome. And tell us about this great man we're going to meet today. And, I want you to go back to how you guys met, because I got to hear that story this morning as I was driving into work. So it was kind of fun.
Yeah. So Tom was actually an oral surgery resident when I was in dental school. And we had sort of known each other a little bit, but we really got close as we did a trip that was sponsored through the American Cancer Society, where we took a Winnebago with John Svirsky. I know you know John, but John was leading the way, and we went to Southwest Virginia into the coal mining countries and basically did oral examinations and biopsies and all. And so Tom and I did that and partied with John for a week. And again, this was the 80s, so he was still pretty wide open then. But we got to be really tight. He ended up being in my wedding, and we've been fishing buddies ever since. And we also have shared a great passion for dentistry. And so what really was intriguing on, again, one of our times we were catching up, Tom stumbled upon another dentist, I'm sure he'll tell you about, that had come up with a medical device to treat one of the most difficult problems that I think we have in a general practice, and that is just what happens to our aging patient as they get on medications or maybe they get cancer. And again, I've restored thousands of mouths, and there's just nothing worse than having perfect margins and control over everything, and then something that is totally out of our control starts to rob the person of their saliva, and then they just start getting caries everywhere. So salivary flow and some of the things that go along with that are incredibly important. And for the young doctors that are in the room, you may not think that that's a big deal, but trust me, when you hit about the 20-year mark in your practice, your patients sort of tend to age with you. So often it's towards the end of your career that it becomes problematic. And I think back, I had a lot of older patients when I was younger, but I didn't do that dentistry. So it was easier for me to but when it's your own dentistry and it was your own sweat and blood, you're trying to make it last as long as you possibly can. So, Tom has put a ton of effort in this. And I've actually had the device in my own mouth and slept with it. And we'll talk a little bit about what it is. But I think this is an unbelievable solution to a problem that plagues all of us.
Awesome. So Tom, tell us your story. I want to hear how, where you came from, how you stumbled upon this and journey you've been on with it.
Sure. Glad to share that. So I'm an oral surgeon and I practice in Richmond, Virginia, and I've been here since 1990. With the support of my lovely wife and my 3 children, have just had a wonderful span of a career here. Probably about 5 years ago or so, one of my colleagues in town, Dr. Jeff Cash, who's the real visionary behind this whole topic that we're talking today, introduced a concept to me about his frustration, first of all, with not being able to offer a good solution to patients who have xerostomia, and a solution that he's working on. And basically, I would visit him at his house, and I would see the different ideations of this thing. And at first, he just got some IV pumps from a hospital that had to be put on the pole with the wheels and everything, and they each one weighed about 10 pounds. And he started basically coming up with the idea of, they have infusion pumps for diabetics, they have infusion pumps for people that need chemotherapy. Why the heck doesn't anybody have an infusion pump for somebody who doesn't create saliva anymore? Why can't we go externally with this? And so what happened is, within the last 3 or 4 years, probably 4 years, he started working pretty heavily with an electrical engineer. And the whole issue was trying to get this thing miniaturized. The concept itself was valid. But then you have to get it so that patients can actually use this, and so that they're comfortable with it. And so then I remember, I'll never forget, came over to his house once to visit about some other things, and he showed me this new unit, and the thing is slightly larger than an iPhone. And suddenly I said to myself, okay, I know just as much as you do, as much as every other dentist does, there's a clinical need for this. But oh my goodness, this really looks like now we could get some mileage out of this. And so then we both put our shoulders into it. He is, again, the visionary who invented the thing and developed it. And I'm the guy who basically got involved with Dr. Jeff Cash to get the business started. And through some really generous, really committed families and friends, we got funding for this. And I'll never be able to thank them enough. We also got all the paperwork done, well, Dr. Cash did actually, to get this through the FDA. So we got FDA clearance on it. And then on top of that, we got a patent on the flow device, which is programmable for different activities, different times of the day. And then the company was basically born starting in December 2019. And then in January 2020, we started on the process of manufacturing units, creating a website, working on marketing and whatnot. And guess what? This thing called COVID happened. And instead of getting a July kickoff, we literally started in November and sold maybe 1 or 2 units in December. So we're really calling January 2020 our kickoff. But what is this thing that we're talking about? It is a pump, and I'll go ahead and hold it up because I've got one sitting right here. And it's, if you go to our website, you can see it. It's a pump. And of course, you don't have much scale here, except you can see my fingers. It's not very big, and you can attach reservoirs to it of different sizes. And as you can see, it has a belt clip on it. And with the belt clip, you can hook it on your belt, or you can put the reservoir and the pump into a waist pack. And then it runs with a little tube that you can run under your clothes. And of course, I've been wearing this the whole time. And the tube goes to an earpiece, and you simply wear that on your ear, and it just looks like one of the Bluetooth things. And then you probably can't even see it, but there's a microfilament that goes into your mouth. And this thing is dripping all over my fingers right now at the same rate that of published salivary gland secretion. So basically what it does is it replicates the amount of saliva that your glands produce in the basal flow rate mode. It doesn't really, it's not designed to help you with salivary flow when you're eating or anything like that. It's not designed to give you salivary flow to substitute for hydration. But of course, we've had beta testers with this unit, and over the last 4 years, and the results of their beta testing it's astounding. If you go to the website and look at it, you can see the video reports of all of their results. And it basically, to sum it up, they just say it makes me feel normal again. And one of the things to me that was the most moving was the fact that when you have dry mouth, you basically lose the ability to have a normal feeling mucosa. Your mucosa basically turns like leather. So what happens is, once you start using this device again, within a few hours, your mucosa feels normal again. And then The other thing that happens is people with dry mouths are constantly sipping water. And the problem with that is they feel bloated, and the water goes through their mouth so quickly that they can't really hydrate their mouth with it very well. And because of that, it's never satisfying. So by wearing this device, they actually feel like they have normal salivary flow again.
Yeah, this is so important. Now, I'm a big fan of the why before the how. And John, you've actually worn this device while sleeping, and you told me about that this morning. I want you to talk about that. But I think it's really important that young dentists understand this. Restorative dentistry, you shared this with me when going through the Dawson Academy. Everything is temporary. It doesn't matter how beautiful it is. It's going to fail at some point anyway. The other biggest challenge that the United States has is not necessarily the economy or healthcare. Those are big challenges. It's the aging population. We're aging at an exponential rate. Right now in Japan, adult diapers are outselling children's diapers, and they usually set the micro trends. So 1 in 3 babies that's born today will actually live to be 100. So we're going to have a lot older people here in the future, and you're going to do dentistry on them. And no matter how beautiful it is, they're going to be living very long periods of time. Also, with the advancements in prescription medication, people don't understand this. Xerostomia is a big problem in the United States for dentists and patients alike. So this is a natural crossroads that's going to happen for dentists and patients alike, right?
Yeah, and I think the other thing that makes it so complicated is, as we have this population, our practices getting older, sometimes their need, particularly if you've done work on them and you're trying to maintain it, the very best case scenario is it holds up occlusally and it holds up biologically, and then they go off into the sunset. But when you start having increased medications, they're getting increased medications. That usually means they're not as healthy. So it's harder and more dangerous to do procedures on them, right? I mean, nothing's more scary when somebody walks in and you've got to go take a tooth out or put an implant in or do something like that on somebody that pulls out their medication list and it, rolls across the table. And we're seeing that more and more. So, anything that I can do in my practice to keep my dentistry lasting for as long as the patient does, and minimizing the amount of work that I've got to do. So if something does fail, as Kurt says, and it is a margin or something, maybe we can go in there and clean that margin out and put something in there without having to lose the tooth or take everything off. So, for me, and again, maybe it's because of where I'm in my career right now, but this is a subject that really resonates with me because of the number of patients that I have that are, over 85. I think we have 4 patients over 100 in our practice, which is unbelievable when you think about that. One of them has all his teeth. That's really amazing.
Oh.
But I think that the why has to be, anything we can do to help a patient control the biologic and functional disease. Functional disease is about training and learning occlusion, and Kirk, that's kind of been my career. But the biologic disease has to be about, knowing how to get decay out of a tooth, creating restorations that are cleansable, and then taking away of many of these things that are out of our control as we can. And I hope the people that are watching this appreciate the fact that Tom had that little cannula in his mouth the entire time. He really didn't describe it, but that little micro cannula, you really just put between the teeth. You just slide it right above the papilla between the teeth, and it just kind of sits there and just lightly drips, but you didn't even see it.
No, he had me fooled. Like, yeah. we talked for a few minutes. Like, yeah. I didn't even know you were going to pull that magic out.
So I was shocked when he opened the thing up, and I was looking at the device. I think I thought this IV tube was going to come out and be stuck in my mouth. But it's almost like a human hair practically in terms of how thin it is. So again, a very elegant way to solve a problem that I think is that's larger than I think the dental community really wants to maybe admit.
Absolutely. And just, Tom, as you talk to the dental, now, first of all, are there any other solutions like this on the market? And then what have you seen as you talk to the rest of dental communities around this innovative technology?
Right, great question. So there's really no direct competition as far as we know, because we've done tremendous patent searches and things like that to get our patent awarded. There are, of course, indirect competitions in terms of other solutions. And keep in mind, this is a $300 million plus market in the United States alone. And of course, everybody's familiar with lozenges, gums, rinses, artificial salivas, sprays, and whatnot that you can use. But the problem is these things are limited to the fact that you can use them when you're awake. And you also have to keep in mind the fact that certain people have, it's a continuum. Certain people have a little bit of salivary function, certain people have moderate, certain people have none. And if you stick a piece of gum in somebody's mouth and they have zero salivary function, it's just not going to work. And the other thing is these other solutions, you only can use them during the daytime. And of course, this thing you can sleep with. And we've tried it out on patients who use CPAP and patients with hearing aids, patients with nasal O2. So keeping in mind, the population demographics, and this seems to be compatible with all these different ancillary treatments. And so, the bottom line is, yeah, there are other things on the market, but there doesn't seem to be anything quite like this. This is very innovative, very unique.
Oh, awesome. And John, what else would you say is, something for us to be aware of, whether you're a GP or a specialist when it comes to saliva? I think, the education piece on the radiation is huge. I mean, there's so many components to this. You're managing forces, you're doing restorative dentistry, you're managing the patient, which is often one of the most difficult. Any other?
I think the other thing, I think people think that the only cancer that affects saliva is head and neck cancer. And there isn't any question that when they get the radiation to the head and neck, it's bad. It's not as bad as it once was because of the triangulation type radiation they have now. But, there's a kid that is somebody that I follow on Twitter that is a friend of mine through sort of hokey sports, and he's got colon cancer. And here's a kid that's 27, 28 years old that constantly is complaining about the chemotherapy drugs and how it just creates this horrible burning in his oral mucosa and just miserable when he's on that. And so, that is dramatically going to affect then what this kid puts in his mouth, which then is often things that are going to be more laden with carbohydrates, easier to eat, probably a lot of ice cream and things like that then can start to have an effect. So we have to understand that, in this age of complete dentistry, which is, Dr. Dawson's word, but I think for a lot of the people that follow Kirk and ACT, that's what we're trying to be. We're trying to treat the whole human being. Well, it's kind of nice to have some options for patients that are coming in when they have something that's completely unrelated to us that's going on, but then just creates a storm inside their mouth. And I just think that we need to have as many solutions as we possibly can. And again, I've seen the water bottles. I've seen the patient coming in just sipping on water all day. I've seen all the different types of gums. I've tried to have these discussions. I would call John Saversky at the dental school at Oral Path, and it just hasn't been much we can do. But it kind of makes sense that if we can at least have a similar flow rate of a fluid going into the patient's mouth as the salivary glands would give the patient, that is the most logical solution. And again, what I just was sort of amazed by it is I thought this cannula would be kind of cumbersome, but it really was not a big deal for me to sleep with it at all. So that's my 2 cents on that.
Yeah, and I want to add to that, if I could, Kirk. What John said is exactly true. The problems are broadly based across many branches of medicine. Oncology, rheumatology are the two big groups. And but guess who gets these patients in their office in their chair, and guess who really knows about it? I will tell you candidly that, you know, we've done a lot of talking with clinicians in the oncology field, and I'll never forget one radiation oncologist actually said, we just don't see that many xerostomia problems. And you know, I just couldn't believe it when I heard that. And somehow or another, his comment got posted on Facebook, and the responses from all the people who've had head and neck cancer and radiation said, "Who is this person?" And you know, to his credit, and these folks who treat cancers do a great job. And then they say, and this is a quote from one of our beta testers, "You're cured. We'll see you in 6 months." And there's basically nothing that they can offer these folks. And they would if they could, they would if they knew something, but there's really nothing they can offer them for this dryness. So you get this diagnosis, which is very difficult psychologically. Then you have to go through a surgery, and then you have to go through chemotherapy and or radiation. And on top of that, you have this feeling of dry mouth, and it's irritating and it's painful, like John said. And this is what Dr. Jeff Cash was responding to when he conceived this idea. And as fate would have it, he ended up having chemotherapy himself. And after he had indications from his clinical work that he wanted to do something, then he had firsthand experience about how bad xerostomia feels. And that was sort of it. That was the last thing that he needed to really get him motivated to come up with this solution. So these problems are broad-based throughout medicine, but we in the dental field, we are completely aware of it, and we see these people, and we are the ones who are most likely to respond to it.
Yeah, and I think hear about it. I mean, I think a lot of times, you know, like you say, the surgeon does whatever cancer treatment and say the cancer is cured, their job's done at that point. And,
right, that's right.
Again, the side effect of xerostomia, who's the patient going to talk to that about? Well, us, because they view us as the person that's responsible for their mouth.
Exactly.
And they think we should have a solution for them, and it's incredibly frustrating when we don't.
Right. Yeah. So let's say I'm a 45-year-old dentist. I've been through the DOS. I care. I do a lot of learning. I know this is a challenge. I'm thinking three things. Number one, affordability, availability, you know, because I know we're looking at January as your first real month. And then the third one is implementation in my practice. I'm doing a lot of things. Like, you'll help me put this. So, you know, is it affordable? Is it available? And is it something I could easily plug and play in my practice?
Yeah, I can respond to that. Absolutely. So the list price for the device is $12.99, and right now for the April Oral Cancer Awareness Month, we have a code word coupon for $400 off, so the patients can buy it directly through the internet for $899. And then on top of that, clinicians, if they want to incorporate this into their practice, regardless of the Oral Cancer Awareness Month, a clinician can purchase this by contacting us directly for $795. So basically, with the list price being $12.99, that dentist could certainly incorporate this into their practice, and they can decide on the patient's need. If the patient has a need for this, if they can basically introduce it to them and then incorporate it into their routine and their management. Also, and I'd like to mention, HSA funds will cover this. FSA funds should cover it, will cover it. And then the should actually goes to insurance companies. We don't have a specific code right now for insurance companies to cover this, but you can put it under a general medical device code. And if the clinician writes a letter of medical necessity, which we're all familiar with, to the insurance company, there is a case-by-case consideration, and there's a good chance that the insurance companies will consider covering it.
Yeah. That's the one thing. We've had Lori Owens on here, and she's wonderful at helping the dental community understand. If you know how to tell the narrative through codes, medical insurances often will cover. Is that correct? You found that?
Yeah, codes are the mainstay, but then the letter of medical necessity. And, you know, we always tell patients, if you submit a claim and it gets rejected, don't be disheartened.
Right.
Submit it again and talk to these people. And, you know, insurance companies are constantly rejecting things the first time. And then when you pursue this and you press it, usually they'll take another look at it. And there's no guarantee it'll be covered. There's also financing available through the website. And with the coupon for Oral Cancer Awareness Month, it's with the financing that goes through the website, it's $82 a month. So we're trying to, through all those various channels, make this affordable for patients. It is available. We have units available right now. So either way, I think we covered all those fields that you were curious about.
Yeah, absolutely. Cool. It's very exciting. Any last thoughts, you guys? Actually, you know, Tom, for the benefit of people just listening on Spotify who might, can you just tell them, spell it out for them? So if I'm on my phone and I'm listening at the gym or in the car, like how would I find this?
Oh, right. Sure. Well, the name of our website is Voutia.com, and I'll spell that. V as in Victor, O as in Oscar, U as in underdog, T as in Thomas, I as in Isabel, A as in Albert, Voutia.com. It's a Greek word. And it means to take a plunge into some cool water, but it also is a colloquialism for take a swig of something, like a shot of whiskey.
Awesome. All right.
And in terms of parting comments, one of the things that I think is really important to mention is this. Absolutely, if a patient has a really bad case of xerostomia, and if somebody, a prosthodontist has made a prosthesis that has quite a bit of acrylic in there, it's going to be very hard for them to wear that comfortably with a dry mouth. And this device is principally designed and FDA cleared for simply providing moisture. It makes acrylic prostheses more comfortable and more easy to wear. And it just also just makes people with dry mouth with natural dentition feel more comfortable. Right now, we cannot make any claims that it will decrease rate of caries in people with xerostomia. However, there are independent research projects going on right now and university-based research projects to look into this. So I just want the listeners to be aware that this is the very first stage of application of this device. It simply delivers water to your mouth at the same rate that your salivary glands used to deliver to your mouth before you lost that ability. And there is a tremendous amount of research opportunity for this. And we are so excited to offer this to the world of dentistry and to all the creative minds in dentistry who will come up with research ideas that we feel will be applicable in the future, that can be linked with nanotechnology, with sensors that can be cemented on teeth, with Bluetooth technology that can send a signal to your phone when the acidity of your mouth is at a certain rate. The possibilities are endless as the technology grows. So again, we just started in January. We are so glad to have all the support of everybody who's gotten us this far. We are so excited to introduce it to the field of dentistry. Our beta testers have just said wonderful things about it. Our early adopters have also said the same thing. It's a game changer. And in terms of, you know, practitioners who would be interested in having a unit in their office, please contact us. Go to the website, Voutia.com, and give us a call, and we'll talk to you about getting a unit or several units to your office.
Awesome.
And I'll just, well, the last thing is, you know, the other side benefit of something like this is, you know, get one for yourself. I plan on very cold football games and a Hokie Stadium. You can put schnapps in this thing, and you know, there's just a lot of possibility. Value added with this.
Multi-dimensional, right?
That's right.
Oh my. gosh, that's awesome. Well, I appreciate you guys being on and helping us understand this. And then, Tom, I'd love to have you back as you guys make changes,
Yeah.
innovate in future. I have no doubt it's going to get smaller. My son is type 1 diabetic, and every time we go back for a new device, it's like half the size and twice as good. And
Oh, yeah.
it's pretty amazing the advancements that just, devices are making now. So thank you guys for being on. So
Right.
Cool. Well, thank you guys for listening, and keep sending us suggestions for things that you want to see on the show and the Best Practice Show. We will line them up, whether it be from Tom or John. I'll get them both back on and ask them the questions, because you're going to see they are the smart guys. I'm not. I just ask the questions around here. And until we see you guys next time, or you hear from us next time, keep watching the Best Practices Show. You guys enjoy the rest of your day.
See you, everybody.
Yeah.